So I'm your host, Adam Riley. I am the Education Outreach and Testing Manager for Caracol, and I'm a member of the OHMM Steering Committee and on the Communications Committee as well. And then today we will have, I'm your host, and your moderator today is going to be Brian Jones, who is a founding member of OHMM, founder of the SCANFA initiative, and founder of the DIRT advocacy movement, founding steering committee member of U Equals U, and an inaugural U Equals U ambassador. And then our presenter today for the unintended outcomes of HIV criminalization, like I said, is Latoya Logan, LISWS, is the founder and CEO of Project Lift Services and Prevention and Social Justice Agency. A prevention and social justice agency serving males ages 14 and older with a specific focus on Black males. Ms. Logan is invested in eliminating incarceration, homelessness, and mental instability related to community and institutional dysfunction. She has served on the Cleveland Community Police Commission since 2016. She is the author of The Case of the Brownie, examining aggression, trauma, and apathy in Black males, and It's Not About the Damn Brownie workbook, proposed to highlight how trauma is often mischaracterized and penalized in Black men. And just our mission at the Ohio Health Modernization Movement, we are a coalition of organizations and individuals dedicated to ending criminalization of HIV in Ohio. We are mobilizing a broad coalition, including individuals and communities who are disproportionately impacted by HIV, to replace fear-based stigmatizing laws that criminalize HIV status with evidence-based, non-discriminatory laws that protect public health. Organizations that are part of OHMM include AIDS Task Force of Greater Cleveland, AHF Ohio, Canopy, Caracol, Equality Ohio, Equitas Health, and the University of Toledo College of Medicine. Our goals today, so our first goal is to review of Ohio's HIV laws and the impact of HIV transmission. The second goal is examine the role of stigma in non-disclosure and the connection to criminal justice system. And the third goal is to identify advocacy steps to promote safety and reduce new HIV cases and stigma. And as always, you can follow us and find us on social media. Our social media hashtags are hashtag HIV Law 2021, hashtag Modernize Now, hashtag HIV is not a crime, and hashtag OHMM. And with that, I am going to turn it over to our moderator today, Brian Jones.
Good afternoon. Can you hear me?
Yes.
I want to thank everyone for tuning in. A few housekeeping rules. Feel free to use the chat box. Feel free to ask a question at any time in the chat box, and we will be monitoring that chat box. But we're going to dive right into a heavy conversation. And I'm glad we have LaTanya here talking about Black males, because me being a Black male, a lot of times we've been focusing a lot on women here lately, but Black males, especially young Black men, it's extremely important that we have this kind of conversation. So without further ado, I'm going to bring LaTanya on, and she's going to give you a very comprehensive overview. And like I said, feel free to use the chat at any time because we will be monitoring the chat. So LaTanya, how are you doing? And welcome to our webinar series.
Well, good afternoon, everyone. I am trying to start my video, but I need someone to give me access to allow my camera to start. But thank you for joining us today. Good afternoon, everyone here. Thank you, Adam, for the introduction. And I want to thank you, Brian, for talking about and highlighting the importance of focusing on issues impacting Black males, because believe it or not, when we address those issues related to Black males who seem to have the poorest social health determinants, then we can help to elevate the conversation that impacts every single person. So I'm going to share my screen. So let me know if there are any issues with that. I will be monitoring the chat box. So if you have any questions, please feel free to put them there. And Brian is also going to assist me with that process as well. So I want to say to start, I am not an expert on HIV. I am a behavioral health provider, a clinical social worker who wanted to help my community. Focusing on Black males is not just a professional passion for mine, it's deeply personal to me. But when I started to think about how we really can support the population, it was impossible for me not to get invested in understanding more about HIV, particularly how it impacts our community. Cuyahoga County is a top 50 county for new HIV cases. And in the city of Cleveland, 30% of new cases are Black males between the ages of 15 and 24. So this is what led me to really think about how we can change the conversation from just focusing on one area of treatment or prevention and really expanding it so that we're all included in this process of prevention. Our objectives today are pretty straightforward. We're going to review the state of Ohio criminal justice system with particular focus on current HIV laws so that we understand what are the actual, what is the intention of the laws? And then more than that, what can we do to help support individuals who are living with HIV, but then of course the greater community. We're going to examine HIV stigma resulting in non-disclosure. And after we do that, we're going to look at HIV status and incarceration, what actually happens to individuals as a result of these laws. And because I believe that we never leave a person with a problem, we need to leave you with some solutions. We're going to look at advocacy areas for each of you, what we can do in our day-to-day lives, how we can support individuals who are living with HIV, but to the larger context, what can we do about HIV prevention within all demographics. So when you consider felony incarceration an offender, it's important for us to think about what that translates to into our communities. Anyone who has a felony is going to have a more difficult time obtaining employment, housing. There's going to be some stigma associated with that. Anyone who's been incarcerated is going to deal with complex and often chronic trauma related to that incarceration. Even if it was simply an arrest, it was being held in the jail system, or they actually went to the Department of Rehabilitation and Corrections. When you come out with the title of offender, people treat you differently. They expect different from you less often, and they rate your potential behavior as more damning or destructive than other individuals who may not have an offense. The criminalization of HIV across 50 states, so this includes DC and Puerto Rico, includes a myriad of behaviors, but it really focuses on trying to think about, what would the degree of risk be? And based on that, they would have jurisdictions with particular laws. So this chart looks at sexual intercourse, it looks at biting and spitting, and it talks about how many jurisdictions have laws related to that. Even laws on the bottom, where it says sharing objects, sex objects, which could be just a consensual act, could lead someone to being prosecuted for HIV criminalization. Currently, 35 states criminalize the behavior of people with HIV through HIV or STD specific laws. So that means that even if you've not led to increased cases, or you've not had a particular impact on others, you still could face some criminalization. 14 states criminalize behavior that has a negligible or low risk of transmitting HIV, such as spitting, biting, and oral sex. And we see with spitting and biting, this is largely used for individuals who come into contact with police officers, EMTs, who may also be experiencing homelessness. 12 states require people with HIV who are aware of their status to disclose their status to sex partners prior to. 14 states have maximum sentence lengths of more than 10 years, and some states up to life, even if the person who's living with HIV took preventive measures and there was no exposure. 4 states require people with HIV who are aware of their status to disclose their status to needle sharing partners. And as you can imagine, that one is going to be the most difficult, because often when individuals are struggling with addiction, there is impairment to understanding risk potential in that moment to make healthier decisions. So in Ohio, section 2903.11 of our Ohio Revised Code, our HIV criminalization law is considered felonious assault. And this basically means that it prohibits people with knowledge of the HIV status from engaging in sexual conduct with another person without disclosing that knowledge to the other person prior to engaging in sexual conduct. And yes, the slides will be available after the presentation. Why this is important is because in the other aspects of this particular code, felonious assault requires injury. It requires that the person experience some impairment, some consequence to the behavior. Whereas in this case, you don't have to have contracted HIV in order to have someone prosecute you for felonious assault. Our current consequences would be second-degree felonious assault, and the punishment is 2 to 8 years in prison and a fine of up to $15,000. Now, what I was made aware of yesterday by Kim is that it would be 2 to 8 years per offense. So you could quite literally, because you've engaged with maybe more than one person, or you had several acts of sexual intercourse or conduct, that you could receive 2 to 8 years for each of those acts. So we're talking about the minimum being 2 to 8 years, and the maximum could literally be your life. The intended outcomes of HIV criminalization is really in response to trying to end the epidemic and to respond to the risk associated with it. Unfortunately, the best laid intentions and plans don't necessarily work when we're not thinking about stigma attached. So I see in here, what if they didn't know they were infected? They still have to face jail time without being tested. And Robin, that's great, because we're actually going to talk about that a little bit more. If you don't know that you are in fact HIV positive, you could not be charged, because it isn't going to be failure to disclose. But I think that as we go through this training, you'll see that's partially why we're not seeing people get tested as they need to and as often, because if I don't know, then I get plausible deniability. It's what it's called. So the intended outcome starts with, it stops individuals from engaging in risky sexual behavior, thereby decreasing HIV transmission and improving the public's health. Because we still believe in America that facing criminal charges or incarceration is a deterrent for behavior we want to stop. Now, we should know better, considering we have the largest criminal population here in America in terms of the entire world. In Ohio alone, there are over 300,000 individuals who are incarcerated and over another 200,000 who are under supervision or probation of some sort. This is also built on the assumption that disclosure of an HIV diagnosis will lead to safer sex practices or sexual abstinence. And again, this is what we believe, that if people have knowledge, they will make a better decision. We've known for years, since I was a young person, I'm almost 40 years old, that smoking is not good for you, yet people continue to smoke. So even though we know there's a risk, it doesn't mean that people are going to automatically engage in safer practices because there is that risk. The fear of prosecution for exposing others to HIV, they are hoping that if you know you could be incarcerated for this, that you will choose to make better decisions so that you're not, expanding, or I should say, you're not a part of leading to new cases. Unfortunately, this requires a certain level of understanding of what the risks are. You have to not just live with HIV, but you'd have to also understand what's the risk of transmission, how does it actually happen, and what you can do to prevent that. So it's extremely important. The Ohio Supreme Court unanimously upheld a lower court ruling that found the statute served a legitimate governmental interest and regulated conduct. Because again, the criminal justice system is purposed to be a deterrent system, that if people know that, here are the risks, it could be incarceration, it could be fines, that they somehow will police themselves. And if they don't, we'll just use the criminal justice system to address it. Unfortunately, this does not work. In fact, people continue to engage in high-risk behaviors with full knowledge of what the potential may be, because when you're doing that, you think you may be the person that this will not touch.
Another thing, LaTanya, is that our law states that the person whom you disclose to has to be mentally capable of understanding what disclosure means, but it doesn't cover the person who is to do the disclosing, who may, and we know that mental health and HIV can sometimes run neck and neck. So it covers one class of people, but it doesn't cover the person living with HIV if they should have some mental incapacity to understand what disclosure means.
Yes, and you are correct, Brian. And part of that is because there is a sort of a litmus test, if you will, for consent. Who can give consent? So when part of that consent requires that the person is not under any substance, that the person is cognitively capable of understanding both whether it's mental health or cognition, that the person is able to say no, that the person is of age, that the person understands full consequences. So this law is mirroring what is the consent laws within Ohio. So our consent laws don't require the person who is initiating the act to meet the level of consent. It requires the person who's responding to it to meet the level of consent. So what actually happens is studies show that there is no association between the laws and safer sex practices, including abstinence, a decreased number of sex partners with condom use, or even HIV status disclosure. And we see this across the board, whether it's with STIs such as HPV or herpes, or even STDs such as chlamydia and gonorrhea. We're seeing an increase in those, even though we are aware that condom usage can reduce the risk, that, you know, using backup contraceptives is extremely helpful. And we know the risk to our health when we don't engage in safer sex practices. So the laws aren't necessarily having an impact on that at all. Research also indicates that these laws increase HIV-related stigma, which undermine routine HIV testing and HIV status disclosure. And I think it's Naima has in there, this is why people don't get tested, and you're 100% corrected. If I know that I have, that I'm HIV positive, and that me knowing that I'm HIV positive could lead to incarceration, in addition to every other stigma and disparities that I'm faced with, I'm less likely to do what I need to do to stay healthy for myself, let alone other individuals. And disclosing can be met with violence, because again, we still have unrealistic stigma attached to very archaic understandings of HIV transmission and HIV treatment. It seems from Robin, it seems as if disclosure is a one-way street. The party that you disclose to will not be punished for sharing an individual status to the public, which also leads to non-disclosure. If there were laws in place to protect those with positive status, maybe there would be more disclosing. And Robin, I don't disagree with you. And I think that that's one of the things that it's difficult for us to come up with a way of addressing public health issues, because if you tell someone your information, then that information is no longer private because you shared that information. And so then they unfortunately are able to do so. The only thing that comes close to that is when it comes to sending sexually explicit photos to a person. They cannot secondary submit those. So I think it's really, that's a great point to point out. And I don't know how we can kind of meld those two into one. Convictions, of course, ruin an individual's life. And this doesn't mean that there shouldn't be accountability in some cases that might have to go through the criminal justice system. But what it is saying is, do we really think that a person who has had consensual, safe sex with another individual, where there has been no transmission of HIV, should then have a felony conviction and incarceration, and then after that, be required to register as a sex offender? Anyone who has a sex offense is going to have a difficult time finding employment, finding housing because of the limitations with housing. And that's not just in your youth, not being able to live next to a school or a playground or a community center, but even as you age, you will not be able to live in senior housing because it does not allow individuals with sex offenses to do so. So we're talking about a lifetime consequence for a consensual act with another adult. And I think that this is where advocacy really needs to take place, that we're not lumping everything all together, because we're really trying to address those individuals who may not be making healthy decisions for their partners.
Also, Latoya, that the word in itself, disclosure, is stigmatizing, because the definition of disclosure is new or secret information. I'm glad you said share earlier, because it is our, as people living with HIV, it is our status to share. And that, like I said, to use the word disclosure implies that your status should be a secret. So I was so happy when you said share. I could have did a cartwheel.
Well, awesome, because I do think that it is about sharing. You know, we would share with any other illness with our partner to make sure that they're aware of, you know, just what's going on with us so we can better support each other. And I do think that when we call it disclosure, we are saying that, oh, I'm going to drop a bomb on you and this is going to be the worst thing ever. And then, of course, that then reinforces stigma about living with HIV, which we know now it is living with HIV. These particular marketing posts that you've seen about getting tested, I think are super important, because we're moving towards a more inclusive way of talking about prevention and early detection. You know, we have not done HIV prevention and treatment a service within our field, whether you're a social worker, a counselor, a doctor. When we choose to separate HIV from medical care, from just healthcare in general, and we make it this thing that's over there that is strongly attached to the LGBTQ plus community, then we make it an issue that we don't have to talk about unless somebody comes into the room and they say, I am HIV positive. The truth is, we should be talking to every single person about the importance of getting tested, the importance of safe sex practices, the importance of early detection, and more importantly, hope. You know, we can live with HIV for a very long time. You can have a full life. You can get married. Your life doesn't end with this diagnosis. And when we choose to be sort of secretive about it, and we make it a thing that shouldn't be discussed openly, then we perpetuate the stigma, and we continue, which of course continues to increase new cases.
And Latoya, have you, Latanya, I keep saying Latoya.
It's Latoya.
It wrong. Excuse me.
No. It's Latoya.
It's Latoya.
It is.
A lot of agencies are moving towards a status neutral approach, where everybody is the same conversation, be you living with HIV or not, and it's kind of reducing some of the stigma. Have you experienced that or run across the status neutral approach in the work that you're doing?
I have, and I've worked in a hospital before, and we did community work. I worked in the community as a part of the work with the hospital. And we were taught that, you know, it is status neutral. Anybody that you encounter could have anything. They could have TB, anything, you don't know. So we don't want to treat anyone special because we know. We want to treat everybody special because we don't know. And when we do that, then that means that we're giving everybody quality care, because we're not waiting for a problem. We're just coming in saying, hey, we want to support you in the best way that we can by doing everything we have to do to provide that effective service for you. I think it's something that, again, needs to be expanded, and more training should be on it. Still, unfortunately today, if you're not working within the LGBTQ plus community, or you're not working in infection diseases, you probably are not going to be trained as you should in HIV prevention or treatment. So I do hope that that's something that changes in the future. So stigma and non-disclosure. According to research, we know, and you don't even need research, you're a human being and you live in this world, and based on the identities you carry every single day, you know that there's some stigma there. People assume what you cannot do. People assume what you can do. People assume if you're a threat or if you're a safe person. And so HIV is no different. Stigma can lead to a form of denial. And part of that is fear. It's fear-based thinking. You know, I'm okay. I don't have to go see these doctors. I don't have to subject myself to being judged or being set aside or treated differently because of this. You know, for a long time, in order to receive HIV treatment, you would have to go into a building that specifically said that. And so a lot of people didn't want to be associated, even if you were just going there for prevention. I don't want to be tied to that. And so we do want to think about the ways in which we create an environment that is more inclusive so that people don't feel stigmatized just walking through the door. Stigma is a powerful deterrent of individual freedom and self-determination. because we begin to internalize those negative perceptions, expectations, and of course, beliefs. And that it makes it much harder for us to make healthy decisions or even to make decisions that would help create stability, which leads to treatment, compliance, and of course, just long-term stability. Research shows that disclosure often involves risk, that when this information was revealed, it could be embarrassing, negative, or emotionally intense. In fact, this research article went on to say that women who disclose were more likely to experience violence at the hands of their partners, just for fear that they got it, even if they did not have an HIV transmission. So we do want to think about this almost in the way that we think about domestic violence to a degree. When we're trying to support somebody who's in a domestically abusive situation, we handle them with care. We create a safety plan. We put in backups and support so that when they're ready to move, they can do so with a clear understanding of how to stay safe. And I think we need to do the exact same thing for individuals who are HIV positive and they're ready to disclose that information to their partner. How can we best support them to develop the confidence and the safety and a backup plan when they're ready to disclose?
And you know, Latoya, Latoya, also, that coupled with implicit biases, and even us as people living with HIV, and I prefer to say I'm a person living with HIV as opposed to HIV positive because I'm more than just my status. Even we have implicit biases towards ourselves as people living with HIV. So, and the public at large, as we try to share our status, we have to wade through not just the stigma in itself of HIV, but the implicit biases that people have if you're LGBTQ, if you're Black, Muslim, and same gender loving. So we have all these other isms. And stigma, I always say that the stigma lies in the systemic and structural disparities. Because for me, there's stigma in everything. Being too light, too dark, too tall, too short. But the systemic and structural disparities keep us in those different boxes.
Absolutely. And this is why I think that when we're talking about addressing stigma within the HIV field in general, we need to start talking about it when we talk about other areas of stigma, because that's a way to destigmatize it too. If we only talk about HIV when it's about HIV and we're not talking about HIV and mental health, we're not talking about HIV and housing, then we leave it into a subgroup or a subcategory where people get to continue with their implicit bias or even in some cases explicit bias about what kind of a person contracts HIV, what kind of a person gets sick, who makes poor decisions, and so on. So I do.
Can you talk a little more about the decision, the Omarzu? I may be pronouncing their name wrong, just a little bit more.
Yes. So part of what the study talks about is really thinking about why would you disclose a secret in general. So every single human being has something we've not told another person. And even if one other person knows, like we know that secret, right? And we carry the secret because we're afraid or ashamed of what people will think about us if they knew this thing about us. The problem with that is that the secret is only as powerful as you keeping it. The moment you disclose, you can be empowered through that disclosure as long as you have support systems in place. So some of this is about understanding cognitively the risk associated with disclosing. What are treatment options available to you? Some people aren't disclosing because unfortunately, they still are buying into past stigma that if you are HIV positive, you're going to die immediately and you're going to get AIDS. And we now know that's not the truth. Unfortunately, we're not seeing enough of that in the media or even in movies and things in places where people consume information to help challenge that understanding. People not getting tested is also why people don't get disclosed. If they don't disclose, if I don't tell you, if you don't know, if I don't know, then I get to go through this world with some level of relief, because if I don't know, you can't hold me accountable for that. The problem is that that's killing you, because once you know, you can do something about it. And that's why it's so important for us to eliminate any barriers that are preventing individuals from choosing to get tested, from choosing to engage in preventive services. And if they are HIV positive, to help them get connected to treatment that gives them those options to live a full life. The research also goes on to say that the laws do not take into account whether the person living with HIV took all necessary precautions to prevent transmission. And I think that that again is super important, because when we think about felonious assault, you know, the most basic way we can think about it is I as a person have assaulted you and created injury. Maybe I left a bruise, I broke a bone, something to that effect. There is something that transmitted between the two of us. With this particular law in HIV, nothing may have transmitted, but you still will be held accountable as if you did. And that's problematic, because people who are making healthy decisions are doing what they're supposed to do for themselves to stay safe, but also to make sure that their partners are staying safe, will still be penalized in the harshest way possible. And that doesn't help our system, that doesn't help people, and it doesn't help to eliminate the basic barrier, which is HIV stigma. 9 states do provide defenses for taking measures to prevent the transmission of HIV. So there are 9 states that have chosen to say, we will offer, like we have a department set up to support individuals living with HIV who have taken the necessary precautions to prevent transmission should they be accused in court. And that's a huge leap, because that's what someone else said about how do we support and protect individuals when they disclose? How do we support individuals who may be living with HIV when their information is disclosed without their permission? So this is a way that it offers. So those states include California, Colorado, Iowa, Michigan, Missouri, Nevada, North Carolina, and Virginia. Each of those states have modernized their laws, which we're going to talk about what that means in a moment. And Illinois has repealed its law altogether, which I think is the goal of where we want to go, is to eliminate criminalizing the status of HIV.
And also we have to remember that Texas was the first state to repeal their law back in 94. I could be either 94 or 96, but they still continue to prosecute under attempted murder and more stringent laws, general prosecution laws. So repealing the law. So everybody is looking at Illinois with bated breath, because they've managed to have a successful repeal thus far, but people are still, the eyes of the nation are on Illinois.
Absolutely. And I think, and rightfully so, because done right, this means that we offer individuals living with HIV more options, and we don't disallow having HIV be the criminal offense, that you're living with HIV and therefore you are guilty of anything that you might be accused of. So that takes us to advocacy. So in order for us to advocate for anyone or any particular issue, we really need to understand where it comes from. And like I said at the beginning of this, you know, I didn't start out in really attempting to understand HIV. I started out in mental health and really trying to support my community. And what I found was there's no way to support my community in making healthier decisions and improving their wellness and creating stability if I too don't understand HIV prevention, HIV treatment, and the importance of me talking about HIV and everything that I'm doing. When we're choosing to separate things out and let them exist in their own categories that never seem to touch, we perpetuate the idea that that's not my issue. That's their issue. They work in the HIV clinic. It's all of our issue, because it's the only way we end stigma. The more we normalize the importance of HIV testing, the more we talk about safe sex practices for everybody, not just individuals who are living with an STD, STI, or HIV and AIDS, but for everybody, then we can start to get to real solutions that can reduce the risk of contracting HIV. So what we know in terms of the criminal justice system is that it's arbitrary. We know that there are racial disparities within the criminal justice system. We know that there are economic disparities within the system. If you are able to hire an attorney and, you know, fund your defense, you probably will end up with a less severe consequence if you receive a consequence at all. So that's just the basics of the criminal justice system regardless. But when you are experiencing an HIV related case, we have seen that the criminal sanctions are even more disproportionate to those who are socially or economically marginalized. I see in here these laws don't seem to give people any kind of defense. How is that allowed under the Constitution? I agree with you, Adam. I don't understand it because I do believe that it is a violation of the Constitution, that there's no due process. And that's actually, I think, the next slide that we talk about. The likelihood of conviction without sufficient evidence is prevalent. I can simply say, you didn't tell me. And I don't have to prove that. I could just assert that you didn't tell me. So it is possible that there will be abuses of this law. If someone gets upset and they decide, you know what, I'm going to say you didn't tell, that case is going to be taken. That case can be tried. And the unfortunate piece to it is they probably will win that case, because research also tells us that court systems tend to give greater weight to the accusations or accuser than they do the person who's in defense of themselves. So me just making the accusation or allegation that you did not share the information, I'm going to be given the presumption that I am innocent and I am telling the truth and you are guilty. In Georgia, a woman received an 8-year sentence for failing to disclose her HIV status, despite testimony from 2 witnesses that her sexual partner was aware of her HIV status. Her status had even been published in the local newspaper, which ran a front page story and a follow-up on her. So even when there is sufficient evidence to suggest that, you do know, or I'm testifying on your behalf, the unfortunate case is that the court system tends to err in favor of the accuser. So I agree, this is difficult.
Something that you something that you said that was in your bio, and I've really been concerned about it, where you talk about how trauma is often mischaracterized and penalized in Black males. And so I didn't know where, but I've been curious about that statement. If you could talk about that a little bit.
Absolutely. Trauma in general is a topic that we're learning more about every single day. I mean, technically, it wasn't until 1980 when we received the diagnosis of PTSD, post-traumatic stress disorder. And every year since, we've been trying to expand the DSM, the Diagnostic Statistic Manual for Psychiatric Disorders, to include a more comprehensive and open explanation or criteria for trauma. Trauma is truly subjective, which is why it's often mischaracterized and missed, and I do mean that, missed in Black males, but really in people of color. And largely that's because when we're looking at individuals, we want to see ourselves. So if you don't look like you're in distress because I have an expectation of what distress looks like, then I'm probably not going to assess it as distress. So what we have to do is engage in a better process of developing symptom characteristics across all of the disorders that would be reflective of cultural inclusivity, gender differences, religion expectations, and even some expectations that are just going to be based on the geography of where you come from, because there are certain expectations or way of talking about things. There is an excellent research study that came out about Asian American women and the rise in suicide for them. And part of it was related to just providers missing the assessment for suicide, because they would say, my head hurts or my stomach hurts. And they would get sent to see a medical physician when what we've now realized is that in some Asian cultures, you're going to present mental distress in physical symptoms. So it's the same thing for Black males. In order for us to dive a little deeper and truly connect to what their experiences are, we have to demand better of our profession. And that's exactly what we're saying here for HIV advocates, for states who are saying they want to reduce the risk of HIV. Then you have to dive into the culture and really understand what is happening, and not just make laws or policies or set expectations based on the fear we have related to HIV cases.
Have you heard of an organization called Kick-Ass? Kick-Ass is an organization for long-term survivors. The ASS stands for AIDS Survivor Syndrome. And they finally got to the point where they have scientific data to support the fact that people living with long-term survivors or thrivers have survivor's remorse, that we can't see past the next day because we live so long we're thinking that the next day will be our last day. So they do have the scientific data now to support the fact that we do have post-traumatic stress syndrome from contracting HIV during those early years. Also, another thing I'd like to hear your opinion on is because we all have different thresholds when it comes to incarceration, and Black people either know someone personally in their family who's incarcerated, a male figure who's incarcerated. So we all approach that whole criminalization non-disclosure thing with a different set of fears.
Absolutely. If you are an individual who's been exposed to in your immediate environment, in your immediate family or neighborhood, to high levels of incarceration, and you've heard those stories, your willingness to engage in behavior that may make you more susceptible to prosecution or incarceration is definitely going to be a deterrence for getting tested, for engaging in treatment, and maybe even engaging in prevention. Absolutely. Excellent points. And then I see in here, how do we get our Black males to address this trauma if they've already been traumatized? We do that through cultural inclusivity and responsive treatment and training. So, you know, even though I work with Black males and I am a Black woman, I always meet them and say, you got to tell me about your experience because I can't assume. So that's the thing too, just because we have representation, that doesn't mean that we have understanding. So we have to make sure that our providers are trained effectively to engage with individuals and to be humble enough to say that, tell me, teach me what I need to know. So we have legal standings for risk assessment that normally does happen in cases where this is a pretrial, usually a pretrial activity where you send out providers and you assess the risk of this person. Do they have a pattern of this behavior? Have they done this before? You know, what are their thought processes? How do they engage? Are they complying with treatment? These risk assessments could lead the prosecutors to not pursue the case. Unfortunately, they are not required in HIV criminalization cases. And that's a problem because, again, if you've done everything that you're supposed to do, if you've engaged in safe sex practices, even if you told the person and they're just saying you didn't, this risk assessment could support your case, but they are not required. And they cost a lot of money if you do it independent of the court. So the question in the chat box says, could you talk about post-traumatic growth as it relates to HIV? And actually, that is not going to be an area that I have expertise in because I've not done enough research on HIV and post-traumatic stress disorder or growth. But I will try to find some information and send that to Kim so that you can have it. So best practices, according to the United States Department of Justice, starts with aligning our laws with scientific backing. So in cases where low transmission is possible, we should remove that from being prosecuted. If you've used safe sex practices such as you're on your medications and you're compliant, you're using condoms, you're engaging in safe sex practices that would reduce the risk of transmission, then those should not be included in HIV criminalization, because at that point, we're simply just criminalizing the fact that you happen to be HIV positive. We want to focus on intentionality too, because if I'm doing what I need to do to protect my partner, then the intent for felonious harm, felonious assault, the intent for attempted murder is obviously not there. And usually in cases where you have this, you would have to prove intent in a court of law. It just has not been required for HIV criminalization. We want to eliminate any laws that are HIV specific, because again, that puts this focus and reaffirms that HIV across the board, just having it is dangerous. And we know that that's not the case. And we, again, want to fight against that stigma. We want to promote prevention across all demographics. So every single person that you touch, you should be talking to them about prevention, whether that's PrEP, whether that's condom, whether that's really engaging in HIV education so that you truly understand the risk associated with it. And we normalize getting tested.
And I also have to mention U equals U. Undetectable equals untransmittable, which says that a person who's living with HIV and is on effective treatment, they cannot transmit HIV to their sexual partners. And this is people living with HIV doing their part to prevent transmission.
Absolutely, and that's a really good point too. undetectable equals that it's untransmittable. And I think that that's where we haven't done enough education around that, like that you literally can live with HIV and not be at risk for transmitting it.
And women can have babies. Vertical transmission is non-existent nowadays from mother to child. And I think that's important too.
Yes.
And I think I didn't realize how important breastfeeding was to women too. And I think that's an area that more research has to be done in terms of transmission. But it's very important to women to breastfeed. So that's just an area I thought would.
Yes, that's perfect, because again, when we're talking about HIV testing across demographics, that means all people, women, individuals who identify as heterosexual, people who tell you, I'm not doing a darn thing, still need to be educated on HIV and be encouraged to get tested. And Robin, you're correct. It doesn't make good sense to prosecute someone who has done everything they need to do. But here's why they're able to do it. It's called discretion. It's called bias. And unfortunately, if it's a law, then people have the right to choose to prosecute those laws. Every prosecutor may not pick up those cases, but there are going to be some who choose to do so. And a lot of that has to do with fear-based thinking, archaic ways of thinking about HIV, that you have to be the worst person if this is what's happening. So again, through education, through normalizing HIV as a lived experience, that prevention it works and that treatment works. That's going to change things. I mean, even with PrEP, now there's a huge push for women to be on PrEP, for people to be on PrEP in general, if you're engaging in sexual activity, because it's a preventive measure. And so now it doesn't have to just be if your partner, it should just be if you're engaging in any behaviors that could lead to HIV transmission, you should be thinking about using PrEP. So legal modernization examples of how we would change those laws to be more current and reflective of scientific backing. The first thing we want to do is to roll HIV into statutes about general infection or communicable diseases. We are not looking to enhance those other diseases and making them felonious assault and raising the charges. What we're seeking to do is to reduce what would be charges or where those are listed, to make it what it truly is, a public health issue. We will require intent to transmit. So there are some individuals who are not necessarily taking care of themselves and are not engaged in safe sex practices who could transmit HIV. There's some intent behind that. You're not doing what you need to do. But this would require that we can prove that intent, not just that it happened, because anything can happen, but that this person knowingly is engaging in high-risk behavior and is choosing not to utilize proper safe sex methods or even medication. We would require HIV transmission in order to apply a sentence enhancement. So the person would have to have contracted HIV from the HIV positive person, not just that they had sexual contact with that person, but that there was no transmission. This is important too, because this actually fulfills the expectation of felonious assault in every other situation, that there would be injury or illness as a result of the behavior. So this is more consistent with what actually happens across the board. We will provide defenses for people living with HIV who took practical measures to prevent HIV transmission. So if you're a person who engaged in all of the safe sex practices to keep your partner safe, then you would be afforded a defense to help you basically avoid conviction and really ruining your life. We would eliminate the felony penalty for people with HIV engaging in sex work who had knowledge of their HIV status. Individuals who are living and working in sex work, because sex work is work, deserve to have safety as well. And as long as they are taking care of themselves and there is no intent, then they shouldn't be penalized because they're engaging in their chosen profession.
But these laws are simply about not disclosing. Whether you take measures, they tend to look over the things that you can physically do. And the laws are supposed to be about intent. Then how can you rule out my intent of I did all these things necessary to prevent transmission? It's just simply about the fact, and we know that 90% of the prosecutions are simply about the fact, and are not about transmission. It's simply about the fact you didn't tell somebody.
Absolutely. And I think that that's why when we're talking, freedom of speech is often pulled into this conversation about HIV criminalization, because it's really, you're being penalized for not speaking. And there's no law on the books for that. So this is why advocacy is important, because penalizing someone for not telling someone something when there has been no consequence does not lead to safer sex practices in the larger community. It doesn't lead to increased testing, and it doesn't reduce the number of new HIV cases. So we're actually doing a disservice when we are leading with consequences and prosecution, as opposed to leading with education and prevention. Finally, we want to remove the provision from criminal code. So instead of having any cases related to HIV be in the Ohio Revised Code, it would be moved to the administrative code and be looked at as a way of helping to control communicable diseases, much like every other communicable disease that exists. You don't get prosecuted for having TB and you knowingly have it and you go into a shelter. You just get removed and you get treatment and you get placed in isolation so that that doesn't spread via breathing. So we can do the exact same thing with HIV cases and individuals who have been accused in this way. It's just providing them with education, providing them with support, and making sure that they're compliant with their medication. We can repeal the provision that criminalization failing to disclose HIV status before sexual intercourse. A lot of people don't disclose STIs, STDs before sexual intercourse. People don't disclose health issues before sexual intercourse. So it's kind of odd to expect that that would change with HIV status. So instead, if we put in measures to support people when they want to disclose, we can definitely do that. And again, the last thing we could do is reduce the penalty from felony to misdemeanor to give people an opportunity to still have stability in their life. So my last slide are just the hashtag decriminalize HIV, hashtag end bad HIV laws, and you can find more information about that. We don't necessarily have time for questions, but we do have a poll coming up. So I thank you for joining. Hopefully this was extremely helpful, and the slides will be available after the presentation.
And I'd like to thank LaToya and Brian for today's presentation. It was great. I think we covered a lot of ground. And thank you to all of those who have attended. Have a good rest of your day.